All right. Hello, everyone. Welcome once again to another Wednesday night webinar. My name is Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. If you're looking for help for OCD or related conditions, check us out at nocd.com. That's NOCD.com. We do all sorts of work like on OCD, and we use exposure and response prevention therapy for that. We do work on body-focused repetitive behaviors and tics and hoarding. And we can do lots of great work with ancillary things, like you'll see mood issues, anxiety issues. We even do one of my favorite things, our NOCD 411 sessions. If you've got questions about OCD and maybe you're a friend or a family member of someone with OCD and they want to know about it, or you want to know about it, well, it's not a therapy session. It's a good Q&A. So we'd be more than happy to chat with you. And I have a guest with me tonight. Hi, Jamie.
Hi, Dr. McGrath.
How's it going?
It's going.
I know you're so excited to be here tonight. That's wonderful.
I'm excited. I've watched your Q&As before. Miss Dana is usually in a lot of them, right?
Yes. She's come into a couple of things, so it's been fun. And why did you sign up for tonight? We like to celebrate certain things and areas. What's your interest in tonight being on here with me?
Well, I saw April, right, was Autism Awareness Month, and it's a great month. I love neurodiversity and people that are on the spectrum or that identify as autistic persons. I've been in the field for about 10 years with people who have been on the spectrum or are on the spectrum and working with them both in therapy. And now I have some clients that are experiencing both autism and OCD. So that's been fun working with that and knowing that it's going to look a little different than it would working with somebody who has OCD but is neurotypical in other areas. So it's been an interesting journey and I like learning about it.
Fantastic. Well, here's what we do. We're just going to go through the scroll and see what happens. If you can see the questions on the side, though, you're welcome to jump around. If there's any that you're interested in and you want to tell me to jump to, we will. That's okay. But I'm interested in the first one, actually. Here, it's from Kazanish. How do I differentiate between an authentic feeling and that of the feelings instilled for me by OCD? Also, I spend a tremendous amount of time rationalizing OCD, trying to understand why does it exist or why it does what it does. It just doesn't make sense to me. Yeah, well, that sounds like OCD not wanting to make a lot of sense to you because it wants you to do compulsions, and that's really what it wants you to do. Now, I love the first one. How do you differentiate between an authentic feeling and that of a feeling instilled by OCD to trick you? Feelings are feelings. I don't know that you're going to find much of a difference between them, right? And if you're going to try to figure out, is this OCD or not OCD, that can become a compulsion, which is why when we're doing things like response prevention, we don't want to say, oh, that's just my OCD, because the moment someone with OCD says that, then they're going to be like, but wait, how do I know this time it is my OCD? Maybe it's not OCD this time. So I really worry that you're going to spend a lot of time trying to figure out what's an OCD thought versus not an OCD thought, instead of just or image or urge, instead of just recognizing, hey, I've got this feeling or this image or this urge or this thought, and I'm going to live with it and allow it to be there no matter what it is. What would you add to that, Jamie? What do you think?
That's fair. I mean, I haven't figured out what's an OCD thought and what are my own thoughts. That would be all day rumination, and I don't have time for that. So I just kind of sit with the uncertainty, not knowing which one it is, and just kind of take it for the fact that it's a thought or it's a feeling. And I'm going to just lean into that uncertainty, let it ride.
People will want to know, but how do you do that, right? How did you get there? How did that happen?
For me, I sometimes tend to be a little sarcastic, so that works for me to kind of just be like, okay, OCD, I absolutely, or, I don't even say OCD. I just say, okay, thought, that's what it is. That's what I'm going to run with. You make sense, or maybe it is, or maybe it isn't. I kind of don't fight it. I feel like fighting it just came up with another what if. So I just lean into the fact that maybe there is a part of me and maybe there's not, but I will never know. But I think at first it creates a lot of anxiety and makes you uncomfortable because you feel you have to have an answer. But then if you sit with it long enough, you kind of habituate to it. It just starts becoming almost like it loses its power. As it loses its power to become that you're not as afraid of it.
Yeah. I still haven't seen anyone be harmed by a thought or an image or an urge.
No.
I've seen a lot of people believe they could be, though.
Yeah, it's pretty powerful. It's intense, and it can definitely try to take over. But it's kind of like I always equate it to like a bully. The more that you turn around and you address that bully that's trying to make you think these things and cause that fear, it's going to lose its power. It's going to back down.
I'm going to jump a little bit tonight because you do want to talk about autism spectrum disorders. And so I want to jump to Valencia here. Can OCD patients with autism spectrum disorders be more reluctant to do ERP? I feel that my contamination fears are justified and think that everybody else is just too careless with carcinogens. How do you overcome the stubbornness? What are your thoughts there, Jamie?
Okay, so I definitely do have some members that struggle with wanting to do ERP because they get stuck in the rumination of, like you're saying, Valentina, it's very real, right? Contamination fears are feel like they're justified because we do see things that are carcinogens and we can go down that rabbit hole. But the issue is often is that we take it too far, right? OCD starts to build upon itself and then we create more and more anxiety and more ruminations. So it's we do it the same way. Like ERP doesn't necessarily change in that dynamic as far as like we're still going to kind of confront these fears. We're still going to use ERP. But we're going to go ahead and we're going to do it at a pace. Maybe sometimes like what I've done with some of my autistic persons is we go at a pace that's more comfortable for them. You're always in charge and you're always in control. And I think that's a lot of times what I've come across is that because of how we've been brought up or because of how things that have happened in their past, a lot of people on the spectrum don't feel like they've had a voice, and being able to be in control of their treatment and say, okay, I need to maybe go a little bit slower, which we learn in our training too is a very valid concern, and letting you be in control and really communicate those fears. And sometimes for some of my people on the spectrum, it's verbally. And that's what I love about NOCD is we have the messaging app and we have other ways to communicate verbally. And that seems to be really helpful to help alleviate that fear. We also have awesome support groups. Really leaning into all of the things that we have here at NOCD has really helped a lot of my members feel comfortable engaging in ERP.
Awesome. Yeah, I love the comfort level discussion because we don't make anybody do anything, first of all, right? Sometimes ERP gets a bad rap because they're like, oh, they make you do all these things. I've never once made anybody do anything. So that's just not the way of doing it. And we give people a lot of credit too, right? In ERP, where we really do believe that they have the ability to handle things that they themselves don't believe they have the ability to handle. So I think that we give people more credit than they give themselves. And part of what I want to do is people to be able to accept that credit for themselves, that they can handle those types of things. So I think that that's really, really important in these situations. How do you, Jamie, when you're working with people, kind of differentiate between what might be on the autism spectrum and what might be more on the OCD side? And of course, we could spend 7 hours talking about that question, I understand. But I think it is important to address tonight.
Well, it's very person centered. So each individual is different, right? We know one autistic person, we know one autistic person. It's
Yeah.
not the same for everybody. And so, and I learned that too. I have a son who's 13 that I shared with you before we started that is on the spectrum. And so, for example, even just the term autistic person, some people don't like that. Some people like saying that they're on the spectrum. I asked my son, well, how would you like me to refer to your autism? He's like, I don't, just call me Antonio. So it's
Mm-hmm.
like, it really just depends on each individual person. And then what I have them do is, well, tell me about your autism. What is going on? What are, some of the things we struggle with? Because someone might have a communication issue, somebody else might have, sensory issues. Like there are definitely criteria to meet an ASD diagnosis, but how, again, the spectrum, right? How much it's affecting that individual is going to vary. So they kind of tell me a little bit about it. And then we go into OCD that they meet criteria for. Tell me a little bit about that. And then we see what is maybe more of like, we don't like to transition, things that we kind of get stuck, things that are more ASD, and then things that are more OCD, but sometimes they're going to overlap too, right? So we might spend a little bit of time getting to know that, but we really kind of just still focus on the fact that they might overlap, and that's okay. What we're really trying to focus on is the OCD and seeing what it is that is making that person struggle with their anxiety. What is their loop? Where are they getting stuck? And that's going to be our focus. And if some of that overlaps, we kind of figure out, do we need to, have a little bit more grace? Do we go up that hierarchy a little bit slower? How do we help accommodate you so that you feel validated?
Yeah. If people have both, can therapy work?
Absolutely. Yeah.
100%. I agree too. But I always like give validation as well, because I believe it absolutely can, right? Yeah. Mm-hmm.
I was like, trick question. I feel like I've got this one. I've got
totally,
this one. Yes.
Totally not a trick question. Yeah. And we really appreciate working with people who are therapists for other conditions. So to me, the value of collaboration in a therapeutic relationship is essential. So if I'm working on OCD and somebody else has an established therapeutic relationship with the member I'm working with for their autism, I want a release of information. I want to talk to that other person. I want to make sure that we're both working in the same direction and we're really helping each other out in the therapeutic alliance that we have to make sure that we're all going to help this person as much as possible, and that our therapies aren't going to interfere potentially with each other either, right? Mm-hmm. Oh, let's see if we had any other ASD ones that had come up first. Or if you found one. People love to ask, Melody asks, do I have OCD? The answer, no, Melody, I do not have OCD. The best compliment I've ever gotten, though, is you sure think like you have OCD. So thank you. Thank you for, if you thought I did, I've done my job, because that means that you think that I get it really, really well.
I thought you did.
Yeah. Thank you.
Yeah. Mm-hmm. Yeah, absolutely.
Yeah. Mm-hmm. Here's one, OCD surviving. My autism spectrum disorder makes me very immature about the world. It makes me very unfit about matters of earning money, being an adult, working, and living alone without relying upon others for my lifestyle. Any help with this? I think that this is an interesting one just because more on the discussion of autism. And Jamie, maybe if you don't mind, and you stated your enjoyment of working with people who are neurodivergent. Can you kind of give us an overview of what autism really is? What is this term neurodivergent we talk more and more about all the time, just for our listeners to really understand?
Well, I know from my understanding, autism or autism spectrum disorder, right, is a neurological condition, and it's something that once you have, you always have, right? And it's something that it you think of the world differently, right? Our brains process things differently. It's not in the same capacity when we talk about neurotypical. That's somebody that doesn't have autism, somebody, I believe, ADHD. There's some other criteria that are met for neurodivergent, where your brain is basically responding differently than somebody else's, than a neurotypical brain. And then with ASD, we know that there's a lot of criteria in order to meet, the diagnosis. And so some of that, looks like people are getting diagnosed more later in adulthood. We're finding out that a lot of people weren't realizing that they had this as children, but it can be several areas, right? It can be like our communication can be a little delayed, our motor, our fine motor, our gross motor. It can also be socially sensory. We sometimes see a big overlap with things like the world itself can be really intense for somebody on the spectrum. Noises, sounds, foods, textures, things that we kind of take for granted. And so that kind of overstimulation often comes out, and we see it a lot in children as fits and tantrums. And really, it's just that they don't know how to express, this is too much. The world is too much. And so, yeah, that's where we try to step in as therapists, as doctors, as parents to kind of help our children fit into a world that wasn't designed for them. And so a lot of people, unfortunately, do go undiagnosed, and then they didn't realize, oh, this makes so much sense. Kind of like with OCD, when you finally get that diagnosis, like, this makes so much sense that my brain is processing these things this way. I'm in a world that was not designed for me. I don't know if
Mhm.
that's the best explanation, but it's kind of the world and the way that I've walked when my clients have members have explained it to me. And then, my son himself, where he's just like, Mom, everything in the world is just so loud. I'm like, well, what's so
Okay.
loud? All of
Mhm.
it. Colors, people, smells. It's too much.
Mhm. There's also, these popular dating shows now, dating on the spectrum, you'll see, and
Mm,
people who are on the autism spectrum and watching their interaction styles and how uh, they can differ, right? There could be things like they get really focused on a certain topic. One of my favorite ones was one guy said, I would really like to date someone, but she must love dinosaurs. And if she doesn't like dinosaurs, there's just no way that I could see having a relationship with her, right? Which was really fascinating. I think for a lot of people that, you know, you, if you don't have somebody on the spectrum in your family, and you hear, oh, someone likes dinosaurs, you probably assume they're a kid, right? You don't necessarily think that could be your 30-year-old child that you're
mhm.
talking about, who also has that. And maybe in terms of the way, and I like how you said the world is loud, a way of approaching the world of, if you've got a topic or thing that you really enjoy, you're really good at, and you feel like you can really master, that's got to feel good for a lot of people, whether you're on the spectrum or not, right? To be able to just feel like this is your thing, you know it, and it's your comfort place.
That's fair. And hyperfixation, yes, that's a key one on any subject. My son's done that with dinosaurs, and it can change, just like OCD themes can change.
Hmm.
With autism, it changes for him. So it would be dinosaurs or it would be sharks. And I mean, it's like a 6 to 12 month period where we're not allowed to talk about anything. Reciprocity is really hard. When you talked about the socialization, which socialization also,
Yeah.
there's sometimes we don't understand why other people feel the way they do. We come across sometimes as very rude, blunt, maybe not having quite the empathy or emotion because their brains are not wired in a way that they understand quite what other people's opinions, points of views are, and why they're not more in line with themselves. So that's kind of hard for them. So I know, like when I don't want to talk about dinosaurs for the 677th time that day,
Hmm.
and I'm like, I'm good. Dinosaurs, whatever, they're dead. They died for a reason. And he's like, oh, he's
Yeah.
like, you're not even my mother anymore. And
Yeah.
I'm like, like, I'm sorry. I'm sorry. So it's just, yeah, it's a different world, and it's wonderful when they let you in, but they are it's very specific.
I like that too, because you are a parent, but you're a human as well. And you will have your own reactions and trials and tribulations and everything living with someone who is on the spectrum, correct?
Yes, he will tell you, and he's very blunt, and he lets me know thing I'm doing wrong on a daily basis. It's
Mhm.
fantastic. So I don't even need my OCD to beat me up. I have my son to do it for me. So it's great, right? Either autism is getting me or OCD. So it's perfect.
If you don't mind, and you can tell me to shut up if things get too personal, but what's it like living in a home where there's OCD, there's autism in the home? It's got to be an interesting experience, I'm thinking.
It is. It is. It can definitely clash because I like certain things, of course, a certain way, and he likes things a certain way. And then we kind of trigger each other sometimes and we don't even mean to. And so there's a lot of grace, a lot of going our separate corners and going to our room. And he can sometimes be one of the most easygoing people until it's something that's really important to him. And I kind of feel like that's the same. I don't know, maybe that could be true for everybody, but
Sure.
to a point, right? Because we all have our stuff. But I
Yeah.
think it gets really hard because, like, as a parent, like I have that overactive guilt, and I think that's that, like, it taps into my OCD where I'm always like, oh my gosh, I'm not doing things right, and then I start to spiral. And then he'll come in and he's just so chill in this area where he'll be like, get over yourself, mom. You're not that big of a deal. You're a mediocre parent at best. So it's like, thank you. But that's just, he doesn't think about it. When I try to explain those things to him, he's like, but that's just the way great, great. Right. So it can be a little hard to navigate because then there are other siblings where they're like, why does he do that? Why they don't understand because they're neurotypical. So
Yeah.
even growing up with him, it's hard for them to kind of get into his world and understand why he says and does the things he does. And then, mom, why are you letting him get away with it? Not letting him get away with it. I'm adjusting things so that he's more comfortable being in a world that wasn't designed for him. So it's hard. It's not easy.
Like here, Tony here says, yes to this. My wife and I trigger each other. She has autism. I have OCD. Her honesty gets me sometimes because my OCD starts me to ruminate about all of these things. So, right? Yeah.
Oh yeah, when Antonio starts telling me all these facts about things, I'm like, I don't need to know. I don't need to know these things. And he's like, oh, do you know you can die this many ways by this thing? And I'm like, no, 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 no. And I'm like, okay, you're fine, Jamie. You're fine. So yeah, very helpful, Tony. I feel that.
Yeah. Um, how I like the sibling question too. I think that's an interesting one. How do you help the whole household to navigate, not just before I was asking about between the two of you, but with the other kids too? How do you live in a home with OCD and autism and children who are neurotypical, children who aren't, a spouse, maybe a dog or a cat. I don't know if you have pets or not, but how do you approach your day to be able to survive it in the best way possible, right? Yeah.
Lots of deep breaths, lots of caffeine. Sleep is important. We
Yeah.
prioritize sleep in this
Okay.
household
Okay.
because it's going to be a long day every day because there are so many different personalities. And so, I have my son who's, autistic, and then I have his siblings. And while they are, more understanding, there are times where they're not. They're kids, right? And they don't, and even I as a parent don't always understand. Really, we're having this same issue for the 554th time, like this week. Like we can't just have our shoes, you know, on these feet at this time with socks. Like it just, just little things that get to be a lot. But what we do is, again, we kind of have a plan. We have to be really meticulous in our scheduling to coordinate schedules and to make sure
Okay.
everybody gets their individual time, right? And I know this sounds horrible, but it's like maybe it might only be 10 or 15 minutes a day. There's like 6 of them, right? So there's like time for each person to be able to feel heard and validated. But we also, what we do, the rule in our house is that if you have something big to say, if you have big feelings, and we all have big feelings, I blame their mother. But if we have big feelings, then we can go ahead and we have to write it down first. Before we say it out loud, we have to write it down first. So if we
Okay.
write it down, then we have to really sit there and think about whether it's worth saying, because it is hard, because we don't always understand. And I think that's true for even us in the world, or us with partners or family members with OCD. A lot of times our members come in and they're struggling because they don't know how to handle their spouse. They don't know how to handle their kid. They don't know how to help. Well, you don't know until somebody else helps you understand it, right? So the person that's going to best help you understand it is that same kiddo. So Antonio makes sure he tells his siblings, this is how I'm feeling and this is why. And they also have that same grace. Lots of family meetings. We all have our time for ourselves. We all have our timeouts in the room. And we just try to show each other grace. And sometimes it's ugly. I'm going to be honest. Sometimes it's ugly. We blow up. We don't write things down and it's a mess and everybody's feelings are hurt. But we keep trying and we go back and we try again. And we just try to do better each time. And just like you would delay hand washing, maybe with contamination OCD, we delay getting angry and yelling out those feelings. Maybe instead of yelling that you're a pain in the butt sibling, every minute we extend it to 5. So
Mhm.
it's trial and error. It's not going to be perfect. People are messy, but we keep showing up and knowing that we'll get through it. And eventually they're going to be 18 and hopefully some of them will move out, right?
I like this one. DC says, is it bad for a parent of a child with autism spectrum disorder to think their child is capable of so much more?
No, because they are. Do not hold your child back and don't let others hold them back. No, because Antonio, he has a 504. He had an IOP and he's very smart. Knock him down to a 504. No, but he gets no more accommodations. Cut those accommodations. I want to see my kid rise to the occasion. If he's really struggling and he needs them, yes. But if he can do it, he needs to do it. And you can expect more. Now you're going to know your kid and you might question or doubt, but if you can give them a chance to rise to that occasion, please do, because they usually can succeed.
This one I like too. How do you help people accept their diagnoses? I'm diagnosed with OCD, autism, depersonalization, and struggle with guilt and questioning if I made it up or if I manifested it somehow. I think that's a really powerful question because a lot of people do worry that somehow they might have done something to have caused this to themselves or to their children. even. And so, Jamie, there's the parent guilt, right? Everybody goes in having children, and I think we hold this assumption we're going to have the most neurotypical child. They're going to be an athlete and in the band and do all of these things, and we set this thing up sometimes in our head, and we hear these expectations from our society and from our culture potentially, and then it it can be hard for some parents then when they discover that that's not going to be met, right? So I think first of all, we ought to set really great, just level-headed expectations of let's let's see what happens when our child is born instead of assuming Harvard Medical School before they've even come out of the womb or something of that nature. But uh, how have you kind of worked with your family around that and for yourself, for your own OCD too?
I think I just wanted to add more flavor to the world. So I went into it knowing that there was a good chance, because I also have ADHD.
Okay.
I like Pokemon. I like to collect them all, right? So it's
There you
like,
go. Hmm.
right. So I'm just like, I kind of knew that there was a good possibility, having studied psychology and how the genetic factors work. So I was prepared for it. I mean, I will say, like, I think it's pretty typical to be like, I want my children to be as neurotypical as possible, because it's easier. Not that
Of
it's
course.
necessarily better, but it's
No.
easier for them,
Hmm.
right?
Hmm.
And
Yeah.
so, yeah, I too, as a mother, was like, well, maybe. But like my oldest, I'm pretty sure is OCD, and she has been diagnosed with ADHD. My youngest is ADHD. My second is anxiety or GAD, and then my son has my other son has autism spectrum disorder, and I still got two more that I'll see what they have when the time, if they have
Hmm.
something. And it's like, what ends up happening when I hear this, I go, okay, and it's hard for them to accept. I've seen it in my children's eyes. It's hard for them to accept this diagnosis, or if some of them need to take medication for the rest of their life, that's a hard one too. They're like, I don't want to be on medication, but it helps their symptoms. So, and not that they all have to, not every diagnosis has to, but I'm just saying that, like, just knowing those things, it's hard for them to accept. And all I say is, I'm here for you. It's not an easy road, but you can be successful. And the best thing you can do is to keep trying, and we'll figure it out together, because I'm never going to quit, and I keep finding ways to make things better and easier, and successful living with these diagnoses. And I think as a parent, we can also be a role model if we have them. And if we don't, find someone that does. Find people that are successful, that have these diagnoses and are rocking out their life. So your child knows that this is a part of life, but it doesn't mean that life can't still be great.
Yeah. Good OCD question here. How can I stop responding to what comes into my head and bothers me? I do therapy, but it's still hard to ignore. Then I start ruminating all day with levels of anxiety and fear. I'm so tired and I don't know how to stop. You know, I say this all the time. Acceptance is probably one of the most difficult things in the world that any human being will ever do. And OCD is a liar. And OCD loves to say to you, there is a solution to this. You just haven't found it yet, but it is there. And if you keep doing compulsions, you're going to get there. And I think that that's where it's hard to ignore Z31 and from what you're describing. I'm glad you're doing therapy. That's wonderful. But OCD is always going to try to get you to come back to its side, right? And pull you in, because OCD survives on one thing, and that is compulsions. OCD eats compulsions for breakfast, lunch, and dinner. And so no compulsions, OCD fades away. Compulsions, OCD gets stronger. And OCD does not want to let go. So it's going to pull and pull and pull on you. And then a lot of people will say, I can handle anything up until this certain level, but if it crosses this level, then it just feels too much. And once OCD knows what that level is, it's going to that level. That's where it is going to go to, is right to that level. And again, that becomes a hard thing for people with OCD, because they're like, why does it always have to be so bad? Or why does it have to feel so real? And well, as we've said on here before, it has to feel real, because if it didn't feel real, well, then you would pay no attention to it. So you've been tricked, Z31, as much as it may hurt to hear that, but you've been tricked. And Jamie, you would probably know from your own OCD too, that it has tricked you your entire life. Has it ever done anything to you terrible or horrible, or has it led you to believe that terrible or horrible things will be there if you don't do compulsions.
Just led me to believe nothing bad has happened.
Mm-hmm.
Yeah, it's not that powerful.
Yeah. But it sure is in the midst of a stressor, isn't
It feels that powerful, but
it?
I get stuck a lot with magical thinking. And so like I actively seek, right, exposures for myself. And like one of them, I use this a lot with my members, is wearing a ring. I used to think that if I wore this ring I would have a bad day, so now I wear the ring all the time.
Mm-hmm.
And I want to do that confirmation bias. Oh, this is happening, I'm having a bad day, and it's such an itch to want to take off the ring, but I'm going to leave it on. And if bad day happens, bad day is going to happen, but it probably isn't because I'm wearing that ring.
Mm-hmm.
I just lean into it. And after a while, sometimes I even forget I have this thing on. So.
Yeah. And has the ring caused anything bad to happen to you?
Not that I know of. I mean, that would be so cool if it was that powerful, but I would like, not maybe bad things for me, maybe for other people, but unfortunately it's not that powerful.
There was a book written about rings, actually. It's called Lord of the Rings.
Rings.
Have you ever heard of that or not? Yeah. Uh-huh.
Yeah, I'll go throw it in Mordor.
There you go. See if it melts in the volcanoes and whatever happens there, right? Yeah. Mm-hmm. And the nerds are very thrilled that you just said Mordor that are watching.
Okay.
I'm sure they will be loving that one. Ben says, I have harm OCD and I'm constantly reminded of the past from months ago when I woke up and I didn't recognize my own hands until I snapped back into reality seconds later, or intensive urges that I've had, or times when I would wake up and feeling like I didn't have full control with harm urges. This is pulling me back from recovery. Am I safe to move on from whatever happened in the past, regardless of the intensity? I wake up and once in a while I'm in such a deep sleep, I wonder where I'm at. Wait, am I? And I travel a lot too. So then I always wake up when I'm traveling, going, where the hell am I? What's going on? These can be very normal things. They don't have to be something that requires a compulsion, right? But OCD basically has established in the lives of a lot of people, here's the norm, right? And if you're on this line, that's everything's okay. Anything that deviates from the norm, right? Uh, Everybody's got to deviate from the norm at some time, right? And anything that does that, OCD is going to grab onto and just try to pull you into doing compulsions. And what I would say, Ben, in this situation is that fear that you're not safe to move on and to face things is OCD trying to hold you back. It's trying to get you to live the life that it wants to live and not the life that you want to live. And it is going through those difficult experiences and learning that you can handle them. That is the thing that will be the most curative in your life versus stepping away from things out of fear. Because if we ran away from things because of fear all the time, well, nobody would eventually do anything whatsoever. Because the bar would get lowered so much for anything fearful that everything would cause people to be afraid. Let's see. Britt says, what does Britt say? Definitely the same. Is it autism or just OCD? Maybe that goes to this one. How does cognitive fusion affect OCD people, or is it just OCD? Um, you know, there's still so much research that we're doing in the areas of autism and OCD, and how fused are people to their thoughts and their beliefs versus are people able to see things in a different way, right? Jamie described for us what it's like for her son and how he views the world versus how everybody else views the world. We're not here anyone saying that it's right or wrong by any means whatsoever, right? People are different. And in the end, Alyssa, I wonder what matters more, trying to figure out what all of these things are or starting to get treatment for them, right? Because I don't know for you, Jamie, but for me, I've had people who want to spend a long time trying to figure everything out, which puts a delay on doing treatment, and I'd much rather do treatment.
I totally agree. It's like I want to feel better. I know I did, and I know a lot of my members do too. And we can go down that rabbit hole. The problem is that a lot of times, especially with OCD, you're gonna just kind of question, well, is this when it started? Is this when it started, or did this cause it? And so it's even hard. Even if you could pinpoint it, you would still probably doubt if that's really when it started, or what created it, or how it happened. And how about we just feel better? How about we work on lessening those symptoms so that you can start functioning in the way that you want? And I'm not saying it's not important to some people. I just don't know that it should be the primary focus of a session, because I want to be able to get you better quicker.
Yeah. We'll do a thorough diagnostic with
Oh, of
everybody.
course.
Jamie's one of our wonderful NOCD therapists that's going to be doing those things for sure. But we want to get you into treatment, right? We want to get you moving into ERP. That's what's really, really important to have people do, is to face those fears and learn that they can handle things. Reggie says, please help me with scrupulosity. Kind of a vague statement, but scrupulosity happens to be one of my more favorite things to work on. There are two types: there's morals and ethics, or there's religious. In either case, there's typically a fear that you've done something that will be offensive, maybe to others, maybe to a higher power. Maybe you won't be able to live in the afterlife that you were hoping to live in. Maybe people will come after you and judge you and evaluate you in a negative way for something you've done. All the way around. The biggest deal that I would say with scrupulosity, and if we focus on it from the religious side for a moment, I've typically seen people are afraid of not being able to live the afterlife that they want to be able to live. And they want to guarantee that they haven't done something that will be offensive to their higher power so that they absolutely can live the afterlife that they want to live. And one of the things that I like to say to people is, there is no amount of convincing I will be able to do to get you to believe that you are okay with your higher power. Your higher power themselves could show up into our session and say, hey, Jamie, don't worry about it. You'll be fine. It'll be okay. And Jamie's going to say to me, are you sure? Right? How do you really know? So people will think these are such important questions, right? This is all of my eternity. So I have to 100% know what the eternity is. But OCD's nickname is the doubting disorder. And the doubting disorder is full of doubt. And what do we know about doubt? Well, you're never going to give the doubting disorder enough information for it to not doubt something, which means you have to learn to live with the doubt and the uncertainty instead of spending the rest of your life attempting to find the absolute answer, because not one person I know with OCD, as old as they are, I've seen people into their 90s, not one of them ever found an answer that they left with saying, oh, yeah, that was it. That was the answer. No more OCD. Thank you. Goodbye. I'm good. Jamie, what on your end, for you, finding that answer and that, what was it like to walk away from that?
That's what's so hard, is that there isn't an answer. I think it's so hard for us to let that go. Like I see that Reggie's talking about, like, it goes way further than that. I'm sure it does. I'm sure the amount of what if, the doubting disorder, what you're saying, getting trapped in that loop, all the things that we can ruminate on and fixate on, and the fear and the guilt and the shame that comes with maybe not doing enough, being enough, listening to our higher power enough. I mean, it can create some really intense, paralyzing anxiety. But the fact is that, just like you're saying, Dr. McGrath, we're never going to have the answer. And sitting with that, that's the key. Doing ERP and addressing those things head on, and sitting with the uncertainty and letting go of the fact that you are not going to get an answer. And that was a perfect example. God, or your higher power, whatever that looks like, it's come in front of you right now. And I'm still not going to be convinced, because my OCD doesn't want to let me be convinced. So I need to take a step back, and I just need to accept the fact that I'm just not going to get that answer, and let it I have to let that go.
Yeah. Uh, and Alyssa says, I dislike not having answers, right? But, Here's the thing. We all don't have answers for many things. So, Alyssa, if you drive, do you have every answer about everything that could happen on your drive? Or do you drive knowing that there is a possibility that the car could maybe, do blowing up or something like that? I mean, or go off the road or something of that nature. Any of those things could potentially happen, right? And so when you get into that situation and you're driving, how do you deal with not knowing exactly how it's going to go? That's what I would ask, right? How do you know for sure? And if you don't know for sure and you still drive, well, then guess what? You deal with uncertainty. And that's what's really, really important to recognize. OCD says it's okay to have uncertainty in all sorts of other areas, but just not this one. This one is bad. So, Jamie, you work with a lot of people who deal with uncertainty. What do you have any fun stories or statements you use for them?
You said a lot of people who deal with uncertainty,
Yeah. Hmm.
like fun story. I mean, I steal your stories.
Yeah. Well, that's okay.
I
Hmm.
do. I give you credit sometimes, but then other
Hmm.
times I like to look like I know what I'm, that I'm just as good at this. So I use your stories. For uncertainty, I mean, when somebody had just mentioned, I noticed in there about the magical thinking, right? Alyssa did that. I love your story of the ceiling. I think I use your ceiling one all the time.
Hmm.
The power of the ceiling coming down. Those ones are helpful. Or trying to get people to like, I don't know, like if they really think that they're that powerful, or the thinking's that powerful, like to really challenge it. Um, just things like that, I guess. When you say stories, like what do you mean?
Well, I mean, I figure you've described living with OCD. Are there
Mhm.
are there times that it like really clicked into you that, oh wow, I didn't have control over something and I handled it, right? That's what I always wonder.
Mm, I mean, yeah, I mean, handle it as far as like we're still alive at the end of the day.
Right.
Like, right. Like we handle it and just, yeah. I mean, um, I don't know. I'm sure there's a lot of times where it just comes down to, I don't know, for most people, just taking that breath, taking that moment, redirecting, and then just really kind of grounding yourself back to the moment. I'm not really thinking. I think my mind's going a little blank here.
It's all right. Uh, just seeing if we had any other questions on the autism experience. Oh, here's another one. Somebody talked about having an edible and then a panic attack, and then that leads to things. People will often bring up in here questions about drug use, and if people ask me, is it okay to use drugs or alcohol and have OCD and everything, I I don't recommend it. Number one, I'm on the OCD and substance abuse disorder 6, so it's not a recommendation. But I will say this: far too many times, and probably because I worked in a hospital for so long, far too many times I heard the same story, which was I used some kind of edible or drug or marijuana or something like that, and I had a panic attack, or I had some kind of really intrusive or intense vision or hallucination or something when I used it. And the panic that ensued, or the feeling of derealization or depersonalization that I had, was so intense and so overwhelming that now I find myself uh, doing everything that I can to avoid any kind of those feelings so I don't have that panic attack again. And some people have even then developed OCD around those things, right? OCD loves a stressor and sometimes it needs something to kick off. So I would just caution everybody that if there are things out there and you're offered them, uh, do we ever really 100% know what's in some of these things? And you have to decide if you're willing to take that risk or not, right? But unfortunately, we can definitely see that there are people who have reactions to things, get this very overwhelming panic experience, and then that has led to other things developing over the course of time too. So it's my cautionary tale to everybody, just to be really wary of that, so that we're not adding chemicals into our body in such a way that it could trigger some other things that are going on. Here came one. I've had a conversation with my friend who has autism and related with having some sort of contamination OCD symptoms. How are they related to autism? So, uh, what would you see, Jamie? Or as you said, if you've met
Mhm.
one person with autism, you met one person with autism, and I would say
Right.
similar with OCD as well. But do you have some ideas about what might be some ways to tell the two apart, right? Where where might autism end and OCD begin for some folks?
Um, so with OCD, like there's a marked anxiety, right? We have anxiety about around like the intrusive thoughts. Whereas when from what I've seen working with members and my son is that the anxiety isn't always there. I'm not saying it's not there, but it's not there and it doesn't always switch themes. Like we get really stuck. We're pretty rigid with an ASD diagnosis with now I'm not saying if it's comorbid it's going to look a little different, but if we have just autism spectrum disorder, we get very particular. We don't transition sometimes very well. We get hyperfixated on certain topics. So it looks a little different. Whereas with OCD, there's themes and there's so many things that we start taking and ruminating and running with. So rumination is, I feel, more of it in the OCD. With ASD, it's more hyperfixation. Am I explaining that right?
Sure.
Maybe
Hmm.
you're like, sure. Well, just like you're interested in a topic and you want to get obsessed about that topic, you're hyperfixing in it. But rumination about around an OCD theme or stressor and your anxiety, it's all what ifs and you start to get concerned. So like when you talked about contamination, like he's seeing some similarities, you might feel like you're hyperfixated on contamination, but really what it is it's a fear that's kind of controlling your life and creating anxiety in this loop for you, as opposed to with ASD, we're actually hyperfixating on a topic we like and we're trying to get as much knowledge as we want. It's not creating anxiety for us. That sounds a little more, in, I mean, just in my opinion, comforting. I'd rather find out a bunch of stuff I'd like to know about. So I'm not sure if that's what the question was kind of saying, is like maybe he feels like there's an overlap there.
Hmm. There's people also who talk about sensory issues, which can happen in autism, can happen in neurodiversity, and we might even see in OCD as well. Someone said wearing certain clothes because they were comfortable, but now feeling as if they don't wear them, they'll feel dirty. So maybe even a little bit of a crossover there. Uh, what kind of sensory things have you seen in working with people?
Well, lots of sensory stuff. Like I said earlier, the world just doesn't feel like it's made for people with ASD diagnosis, but it's also true for people with ADHD, and like you said, even some OCD. There's a lot of overlap, and it depends on each individual person. You know, one, you know that person, and so I know like food textures. You know, potatoes or bananas. It doesn't matter the food. For some reason, that person just doesn't like it and can't eat when we look at avoidant food restrictive, disorders or other things that maybe they can't eat, or the sites are, there's just too much light or there's too much going on. Things smell. Can't wear perfume around certain people because it can make them physically sick. It's just too intense, even if you're not wearing a lot. The sounds, like just like the sounds can be distracting. And like I said, it can be for OCD and ADHD. And earlier when you were asking me a question about, my examples, I'm getting overwhelmed by the sound of a fan, something going on outside. You're asking me a question. I'm looking at all this stuff going on over here. And I'm like that's what happened. I glitched. I always call it a
Hmm.
glitch. I'm like, it's my brain could not remember what you're asking and it started shutting down any memory access because I'm getting overstimulated by what's going on around me. It's
Yeah.
fun.
And allowable, right? Because we're also a human too. And even if you didn't have any diagnoses whatsoever, you could still get overwhelmed by things. So that that is that is a normal human function experience
Well,
also.
for example, if I dropped all 6 of my kids off with you right now, do you think you might get overwhelmed, sensory overload?
I know. I don't think. I know.
Right. So yes, everybody can get overwhelmed.
Mm-hmm. Yeah. That would, let's just say that would happen for sure. Mm-hmm. Yeah. uh, and too, like, that's what I love about the community too. People give each other a lot of support and a lot of kindness. Yeah. Just trying to see if there were any other ones that were out there that maybe we didn't address as of yet.
I noticed one earlier that I thought was a little bit interesting. I mean, it was talking about how she had a baby and then she felt that she kind of like some of her progress had relapsed a little bit. And I know we've talked about that before. Just in trainings and conversations, but I just thought that was interesting because we were talking about when you have a child and there was no extra context, but is there something there, where did we have a neurotypical child, and then if we have OCD, it just latches on to, am I going to be a good parent? So it's kind of like you've unlocked a whole new level of OCD. And looking back, because I wasn't diagnosed young, I didn't realize this until recently with the OCD diagnosis, that it happened with each of my children. It got worse. The hormones, everything on top of the OCD, having babies, all that flood, a new one. And then you're just like, that child is different. And the OCD is going to latch on to anything that's important to you. And it absolutely will do that. So what I just wanted to let her know, that's completely normal, what she's going through for the OCD journey, that you unlocked a new level. Congrats.
Yeah. I and as I like to say, there's an infinite amount of levels. So it's not like you're going to finally get to that end level and there's the big boss there to fight. The big boss is infinitely far away. So there's an infinite number of levels. It's turtles all the way down kind of thing, right? And just that's just the way that it goes for everything. Oh, do you have turtles all the way down?
One of my members told me about it. I'm so excited.
Yeah.
I'm reading it. Yeah.
Did you see the podcast I did with Mr. John Green himself?
And somebody told me about your podcast. It's in my list of podcasts. You're in there.
Awesome. Good. Yes. That was a fun one. It was really great to talk to John. And, John was very open about his OCD too, and having written a book with a character that has OCD. So it was really a fascinating experience to spend some time with him and get to talk about it, which was really, really great. Mm-hmm.
Well, that's cool. And you're seeing somebody with OCD being so successful too, right?
Yeah.
So that's great. And it's nice to get that support.
Yeah. Before we wrap up, any final words or thoughts or encouragements for people out there who, you've got your lived experience of OCD, you've got a lived experience of having a child on the spectrum. Just, I give you a little platform. What kind of advice would you like to give to others?
I try to give myself grace daily, as far as like, it can be really hard and overwhelming navigating it, and I'm not going to do it perfectly. And my OCD, get a little emotional because it's hard. Like, it's so hard. And you want the best for yourself, you want the best for your children, you want the best for your members. And I think a lot of us go into this field because we didn't have the answers, and we want to make sure we're available to you out there. We want to make sure that you're getting the help, and that you're getting the help early as we can detect it. But I think the biggest thing you can do for yourself is make sure that you're getting what you need. You're getting that help. You're seeking therapy. You're reaching out. You're getting a community. You're coming to things like this. You're supporting one another. And that's what I make sure to do for myself. I have my people that support me, that are in my corner, that know what I struggle with, that are knowing when I need a break, when I need to take a step back, when I can't be the one that's in charge all the time. And I do the same for those around me, as well as for my children and for my members, whoever. We're there to help, and we're not going to do this perfectly, but we're going to get through it together. And I think that is just kind of the biggest thing I've learned throughout this process is to just be patient, which is really hard because I want answers. I want it now. I'm totally one of those people, if they ever make a miracle pill, I'll sign up for it, but I don't think it's going to happen. So until then, I'm going to continue to just realize that this is part of life and that that's okay. And I can say that the other thing too is, aside from giving myself grace and trying to be patient, is that it's kind of made my life better. It's made me a better person. I think it's made me understand people and be more compassionate, because I know the compassion that people have to give me. So it's definitely humbled me in areas that I used to not be so humble in. And having kids that struggle too, it's made me be more caring and patient with others, knowing just the amount of effort and time and energy that has to go into helping people understand, you know, their diagnoses and what it takes to heal and what it takes to do to get better.
I want to leave with this one. Does OCD, especially like suicidal OCD, get better? Have you seen people grow and develop? Absolutely. I wouldn't do this job if I didn't see people get better and grow and develop. I'd be a pretty terrible therapist if I just worked with people who didn't improve whatsoever. So there are so many opportunities for you to start to live the life that you want to live and not the life that OCD wants you to live, no matter what the theme of the OCD is. Because we've even seen on here tonight, some people say, oh, scrupulosity would be so difficult to deal with. No, suicidal OCD is hard to deal with. Whenever I ran a group at the hospital, it happened every time. The new person would say while someone else was talking, oh my gosh, I wish I had that kind of OCD. That would be so easy to deal with. Everybody thinks that all the other subtypes would be the easier ones to deal with than the ones that they have, but that's just simply not true. OCD attacks at the core the things that you love, that you enjoy, that you want. And that's going to be different for everybody. And that's why when you see someone else's type of OCD and think, gosh, that would be easy to deal with, it just means that that thing isn't as important to you as it is to that person, right? And that doesn't mean that you're a bad person for not thinking that's important or not. You haven't grabbed onto it. It hasn't just been something that's been a bother to you. So OCD is really, really good at digging around until it finds the thing and then just grabbing onto that. But then it can shift too. There may be other things where someone might think, oh, wait a minute, that sounds like it would be even worse than what I've got. And boom, now suddenly the thing you had, you wish you had, because that just seems so much easier than the thing that you have to deal with now. And why can't I just go back to that old one? Wouldn't that be great just to have that one again? That ever happened to you, Jamie? Maybe a few times? Yeah.
All the time, all the time. Though my fiance keeps trying to lead me into the contamination one. He'd like me to clean a little more. So I don't think it's going to happen though.
Mhm.
It doesn't work that way.
No, it really doesn't.
No.
Well, Jamie, tell everyone a little bit about you and like what states you're in and everything. Maybe they like you and they wanna see you here at NOCD.
Or maybe they don't and my OCD starts spiraling.
Yeah, well,
Right, there's that too. I work at NOCD. It's like I know this Dr. McGrath, but I work at NOCD. I'm licensed in Arizona. I'm a licensed clinical social worker in Minnesota and Oregon. And I really like my job. I really like helping people with OCD, and I have a lot of clients that also have ASD, autism spectrum disorder, and it's great. It's great to be able to help people and see results. That's what's so great about this job is you actually see results. So that's fun.
awesome. Well, thanks for joining me tonight, Jamie. I really appreciate it. And thank all of you for joining as well. If you're looking for help for OCD or related conditions, check us out at NOCD.com. That's NOCD.com. And if you want help, we also can in areas like hoarding or body-focused repetitive behaviors or tics. And we even have our NOCD 411 sessions. So if you've got questions about OCD and maybe you're a friend or a family member of someone or they might not be ready for therapy, but it's really affecting the family, we'd be happy to do a call with you just to discuss ways to help manage that and deal with that and maybe even put some boundaries in that situation as well. Until next time, next Wednesday, I thank all of you for joining and go out and do the life that you want to live and not the life that OCD wants you to live, because that life, not so great. If it was, we'd be giving OCD to everybody instead of help taking it away. Be good, everyone. Thank you all for joining. We appreciate it.